Namaste and welcome to the next episode of Clinical Ayurved. Myself, Dr. Mayuresh Agte. We were discussing Kas Valley and I have asked you one question that in practice we come across many patients which tell us that they have got Kas because of some allergy. It may be of dust, pollen, pollution, smell from kitchen, perfume, smell from dhoop or agarbatti or incense, anything, any factor, such factor which comes in the contact with them, they start showing the symptoms. How we will analyze such patients on the basis of Ayurved and what is the solution for such patients, let us discuss in today's episode. Now I have started the topic with the allergic cause or allergic bronchitis, but in spite of allergic bronchitis, I will take this subject to first allergic sinusitis because it will be easy for you to understand, and then we will go back to the allergic bronchitis or allergic cause. Now, in a home there are four persons living. They are living in same atmosphere. They are eating same food, rutu, kal, etc. Everything is same. But one among the four starts sneezing, starts problems or sinus when that person comes across with the dust or smell from kitchen or any strong smell like perfume, dhoop, incense, agarbatti, whatever it is. Now, other three persons are also living in the same atmosphere. They also come across all these factors, but they don't get any problem. But one person starts sinus problem when he comes in the contact with any of such factors. What actually happens when we say a sampratya of vyadi? There is a Sanchay Prakop, Prasara, Sana Samshay, Vyakti Bhed, all these six steps, and the Vyadi is seen in the body of the patient. But when a person of allergy specifically comes to you, you will find many times that there is immediate reaction. Some dust goes in the nose and he starts sneezing. Some smell is enough to trigger the symptoms, and all this happens in a fraction of second or very short interval of time where we can't even analyze Sanchaya Prakop Prasar Sthan Samshay Vyakti Bhedavastha of dosha. So when you have to analyze this patient, you have to think of the different things little differently other than the proper samprapti. As a hetu in the of the caste they have mentioned Raja Dhuma, so you can relate with them. But for the samprati of such patient, you have to think some by the different way. Now, four patients are living in the same atmosphere, coming in the contact with the same factors, but three of them don't get any problem. It means their pranava srotas is very capable to adjust with such factors. Their pranava srotas, they also come across the dust, smell, dhoop, etc., or smoke of the agarbatti, etc. But when these factors go from the nasal cavity, that nasal cavity or that srotas of these three persons living in the home is strong enough to resist or to tackle these factors which come in contact with them. But the one person who gets the problem immediately or after this coming contact with such things is not able to adjust these factors. So the body of that patient or specifically pranavasotas of that patient starts showing symptoms because these external factors are not adjusted by the pranavasotas. And what will the reason? It means bala of srotas is on lower side as compared to other three persons. Remember, though we have mentioned in the text Vataja, Pittaja, Doshaja, Kas, etc., in these persons you have to think of the immunity of the pranasotas on the primary level. Immunity is less. That's why these patients, when they come in contact with the some allergen which are or the factor which is not suitable to their body, they start sneezing. Hence, whenever there is allergy of any kind, I have taken example of sinusitis, but allergic bronchitis, sinusitis, skin allergies, or allergy of some food, dahi is, curd is taken and there is some problem, acidity, whatever it is. Any allergy of a particular srotas or organ or avayav, it means the immunity of that srotas or organ is on lower side, hence that srotas is not capable to adjust with such factors when they come in contact with the body. When there is no contact, the patients are very normal. But when they come in contact with such things, external factors, they start showing symptoms. Hence, whenever there is a patient tells you that I have got some allergy, first primary diagnosis should be that you have to think of the immunity, and then you can analyze whether the sneezing is vataja, kafaja. It's based on the second part. First, you have to think of the immunity, and in the world, only Ayurved is the medical science which can increase the immunity of the srotas by Rasayan Chikitsa. No other medical science has got this principle to increase the immunity of the body or particular srotas or particular avayav. Hence, whenever there is allergic condition, I have taken examples of sinusitis. First, always obviously hetu parivarjan. The ask the patient to wear mask, helmet, and avoid the allergic factor which is disturbing his body is always on the primary chikitsa, hetu parivarjan. But in practice or in our life, it is not always possible to get away from these things, which is very difficult. So next thing will be you have to increase the immunity of that srotas. So when there is sinusitis, you can use pippali. When there is bronchitis, allergy, you can use chavanprash, kantakaryavaleh, whatever you find proper to increase the immunity. And third will be symptomatic treatment. So when the patient says about allergy bronchitis that when I eat something I get cough, first hetu parivarjan, try to avoid these things. Secondly, give the Rasayan Chikitsa of Pranava Srotas which will increase the immunity of the Pranasotas. For example, Pippali, Chavanprash, whatever you want, you can choose that. And third one, symptomatic treatment along with the Rasayan Chikitsa, that for Vatajakas, Pittajakas and Kafajakas, whatever it is. So, any allergy of any system, 3 points always remember: hetu parivarjan as far as possible, Rasayan Chikitsa to increase the immunity of that particular srotas, avayav or system, and thirdly, along with Rasayan Chikitsa, symptomatic treatment, Lashani Chikitsa, whatever the symptoms are there. Hope you understand these things. Now, I just mentioned one thing that analyze that, increase the immunity first and then analyze the symptom as Vataja, Pittaja, Kafaja. Okay, in the Doshaja classification. Now my question to you. When a patient of cough comes to you, what is the question asked by the doctor? Any doctor since many years. What is the common question? First common question asked, whether there is dry cough or there is bulging or cough is expectoration is there. So dry cough denotes Vatajakas, other one where there is congestion denotes the Kafajakas. Have any doctor asked that there is burning, there is dhumayan, there is daha? in the caste patient. In the Grantha, they have mentioned Pittaja caste Lakshana, the slok is written, treatment is written, but in practice, have anyone asked or patient has said that Pittaja Lakshana of Dhumayan, Daha, etc. and there is caste? Hardly I have seen this. So question to you, does Pittaja caste is seen? Rarely I have not seen in my practice, but there may be exception, but it is very rare. Does really we think of the dry cough or wet cough, and we really go in deep of Pittaja caste? I think so. Does it seen, and if it is not seen, what will be the reason behind that? We will discuss this in the next episode. Hope you have understand what is the diagnosis of allergy on the principles of Ayurveda and what is the solution for that. And I will be happy to have your comments, and we will discuss this Pitta Jagas in the next episode. Again, reminder, episode from lecture from 34 to 60 are made public, which were by mistake not available to all of you, but now they are available to you, and there are many clinical conditions I have discussed. For example, Tittaras is Ruchikara and Katuras is also Ruchikara. Then what will the difference or what will the indication of Tiktarasa in Aruchi, and what will be the indication of Katurasa for the same Aruchi Lakshan? So please go through all these episodes. Thank you very much.